No, it's not us that we have been creating this section. Right. The three years plan had this section already. So it's up to you, whatever you call it. You can lobby to the ministry. That's their. My name is Samita Pradhan, and I work for Women's Reproductive Rights Program under Center for Agroecology and Development. Uterine prolapse is falling of womb of women. Um, it falls off gradually from the canal of vagina. It has 4 stages. In the beginning, it falls off a little bit inside the vaginal canal, and gradually it comes out of the vagina. So when it comes, the whole uterus comes out of the vagina, it has to be removed. It is called hysterectomy in the medical terms. In Nepal, data shows that 600,000 women have been living with this condition, and 200,000 need immediate surgery on this problem. The women have been living with pain and with difficult condition. Women who has this condition, they have very difficult living, like even doing their daily routines, like standing, walking, cooking, working, sitting. And of course they will have difficulties in having sexual relations with their husband, and women have very difficult time, when men also tend to bring another wife when they don't have sexual satisfactions. If there are some health facilities accessible to the health facilities, so they go to the health centers, and get the health facilities. But also, like, even though there are health centers, they do not provide that kind of services, particularly for uterine prolapse. So women have less access. In one hand, women have less access to health services, and also, like, they do not have voice to say to go to the health post, because women's problem is not in the priority in the household. So it's quite difficult for women to decide to go to the hospital, and also getting services from the health services, and also from the health post health centers. Like, there are male health workers, so women hesitate to go there and get the services from male health workers. They have women have some traditional healing system as well. Sometimes they take herbal medicines. They apply herbal medicines, and also they apply herbal, mud, or pieces of flip-flops and all that. They have been,
How do you mean?
Yeah, like, sleeper. The piece of the sleeper, they cut the sleeper. A piece of sleeper, then they put in the vagina just to hold their falling off womb, because they have been suffering from so much pain. They want to do everything they can. Yeah, there have been cases like women have been applying cements inside their vagina, just to hold their uterus, and some women have been applying glass bangles, glass rings, so that it holds, because they have heard of the rubber rings that it holds the fallen off uterus. So they have been trying with the glass bangles, which they use in their hand, wear in their hands. They have been trying, whatever that eases them. And it depends how men see this problem of women. And we have so many cultural taboos as well. For example, during menstruation, we cannot have milk and dairy products, and we have to. Some of the women in the far west Nepal, that they have to stay outside home in a cow shed, or in a different hut. So during that period, they do not get good food, and also, like, in the context of Nepal, women is the last one to have food. So it's obvious that women have less nutrition, even amongst the whole family members. Then women have to work. It's a load of work women have. It's a lot. It's a lot in the country. Even if they say here. Even if they are not involved in the formal sector, they have to work in the field. They have to earn their living. So it's not that their husband would bring the bread and they can eat, but it's the women that they work in the field, and their work is very, very important, and it's kind of women are quite loaded with heavy work, so that is the major causes of the uterine prolapse as well. We need to, it's not only the treatment of fallen uterus, as I said earlier, it's the whole, we need to change the whole society, whole patriarchal society.